Hi, my name is Lynn Hutton. I'm a clinical social worker here at Stanford, and we know each other from the module on how to support children and families through serious illness. So welcome to all of you. It's really nice to have you here. I am drinking not coffee because it's actually 7:30 at night here and there's no way I can drink coffee at 7:30 and still go to bed and sleep. So I'm having a very exciting herbal tea um, for respiratory health. And the little message on my tea bag is plant kindness and gather love. Isn't that inspiring? Um, so where to begin? I thought, because this is just kind of a brief, casual check-in, that I would just kind of highlight a couple of key points that feel particularly salient to me to keep in mind when you're working with children of all ages, actually. One of them is to remember that, children will grieve and re-grieve with each developmental stage that they go through. And it's important to let parents know that because, often it's very easy to think, okay, my child has grieved, I've seen them cry, they've moved on, they're fine now. And then suddenly, what feels like out of nowhere, parents feel like something is wrong, something is happening, they're noticing changes in behavior. And that's completely normal, as the child grows up and begins to understand more about the long-term ramifications of not having their loved parent present anymore. They go through multiple grieving processes. A 2-year-old doesn't yet know that their parent is going to be missing out, 20, 30 years down the road on maybe the birth of their first child or something. But as they get older, the children become more aware of that and re-grieve. So that's something to just normalize with parents and let them know to expect that. And I wanted to also talk just really briefly too about, how do you have the optimal plan of care for meeting with your patient and their children, and rather than have just one way of always doing it, because every family is different. I prefer to have a really simple approach to guide me as I figure out what the optimal plan of care is going to be, and that is to always assess, and gather information before you do anything. So if I have the time, I like to spend 2 or 3 sessions with families, sometimes with the children present, some sessions without the children present, and then with the children alone, getting to know them and gathering information about what their family culture is, how they communicate. Otherwise, I'm not going to know how to effectively and successfully design a plan of care that will work for this particular family. So that would be, my one bit of advice. I guess this is my second because I already shared one. Would be to don't feel like you have to have a perfect plan every time, but approach each child and patient from a point of curiosity and information gathering, and that will guide you and help you figure out how to best support that child and those parents. All right, well, I won't take up any more of your time right now, but I'd be happy to check in with any of you again. So please don't hesitate to post a comment or reach out to me. I'd be happy to chat about any of these topics more if that's something that you're interested in. So again, thank you so much. It's really a pleasure getting to work with you, and I wish you all well. Thank you.